Next, we're going to make our way down to the lower extremities. Again, we palpated the femoral arteries and we got the femoral pulses. We palpated for the lymph nodes. We're just going to do general inspection of the skin, the temperature, any obvious deformities, atrophies. We're going to palpate the knee joints, the ankles, and the foot of both sides, noting symmetry, color, and again, we would do the capillary refill test in the nail beds of the toes. There's no edema noted on any of his lower extremities. So next, we are going to palpate the rest of the pulses. We're going to do the popliteal pulse, which is behind the knee. We'll do that on both sides. We'll do the top of the feet for the dorsalis pedis pulse, and then we will also do the posterior tibial pulse. And we will be checking for regularity and strength of those pulses. Okay, so next we're going to assess the range of motion of his knees. So uncross your legs. Okay. And I'm going to have you extend your right leg forward. That's extension. Now bend your knee. Good. Now put your leg towards the wall, swing your legs as well, and then towards your left foot. Now we're going to do the same thing on the other side. Left foot out, and then back down with flexion, and then towards knee, and then towards your right leg. Very good. And we're going to assess the knees for any edema over the patella. We're going to assess for any crepitus or pain or tenderness. Okay, so next we're going to inspect his feet, and again this would be done with his shoes off. We would be inspecting the nail beds, we would be checking the capillary refill, checking the temperature of his feet, the skin color, and then we would palpate for any tender areas, any nodules, and then we would test the range of motion of his ankle. So I'm going to have you flex your foot towards the floor, now towards the ceiling. That would be for extension, and then inversion. Move your heel inward like this, and then outward like that. Very good. For the next portion of our exam, we will be doing the neurological exam. We did a number of the cranial nerves already. We did cranial nerve number 2, which was the optic nerve for the pupillary reaction. We did cranial nerve number 3 and number 2 for the consensual and direct pupillary constriction. Number 4 would be the cochlear, and that is the hearing test. Number 5, the trigeminal, the sensory. We did the sharp and the soft sensation, and for the motor portion of that, we had him clench his jaw. Number 6, number 3, 4, and 6 were also tested with the extraocular movements and the 6 cardinal points. Cranial nerve 7 was the facial nerve, and it was tested with him smiling, frowning, and puffing at his cheeks. Number 8, the acoustic, we did with the whisper test, as well as the Rin and the Weber test. Number 9, the glossopharyngeal and the vagus nerve, we did that with the mouth exam, with him swallowing and the soft palate moving. 11, the accessory spinal nerve, we did with the shoulder shrug test and having him move his head side to side. And 12, the hypoglossal, we did with him sticking out his tongue and it being midline. The only one that we didn't do was cranial nerve 1, which is the olfactory, which would be the smell test. Now, in addition to the dull and sharp test, we can also do the vibratory test to see if you can feel vibrations. We can use our tuning fork again for that. Okay. Okay, close your eyes. Tell me if you can see that. Okay. And we're going to do that on both sides to assess symmetry again. And next we're going to do the stereognosis test, which is having him close his eyes and placing a common object in his hand and having him identify it. So I'm going to have you close your eyes. Okay. You can close your hand around that. What is that? Correct. Okay, so now we're going to do some fine motor function tests. Okay, turn towards me. And I'm going to have you touch your nose with alternating fingers like this. Very good. Next, I'm going to have you touch each of your fingers, alternating with your thumb. Okay, and then the next test is I'm going to have him alternate between touching my finger and his nose. We're going to start with your left hand. We're going to finger. And now with your right. Very good. Okay, next I'm going to assess his heel to toe walk. So I'm going to have you stand up against that back wall there. Walk heel to toe towards me. Very good. Now you're going to walk towards the back wall on the tips of your toes. And walk back towards me again on your heels. Very good. Next we're going to do the romper test. So I'm going to have you put your arms straight up with your palms facing up and close your eyes. And he's not swaying, he's able to maintain his balance. So that was good. Next I'm going to have you sit down. And I'm going to have you take your right foot and run your heel from your knee down to your ankle on your left foot, and then do the opposite with your, there you go, very good. Next I will be testing his deep tendon reflexes. I will start with his radial reflex, thumb push, and then we'll do the brachial. The fingers pushing, the bicep, and then for the tricep, I'm going to have him bend his elbow. And again, watch for the twitching of his fingers and his thumb. Next we're going, and we would do those on both sides to make sure they were symmetrical. And then we would move down to the patellar reflex. Okay, and we would watch for his foot to move forward, and maybe do that on this side as well, and watch for a foot to jump. And then we would do, lastly, the Achilles reflex, where I would hit the Achilles tendon and watch for the foot to shift. Next, we are going to be doing the straight leg test to note for any back pain. So I'm going to lift his right leg up, like this, and then I'm going to flex the foot, and we will do the same thing for the left leg. Like this. Flex the foot, noting for any pain or discomfort during that. Okay, so the last thing we were going to do today, which was actually going to be the first thing, but I omitted that after I introduced myself, is to check vital signs. So we're going to check the blood pressure in each arm to note any discrepancies in blood pressure. We're going to check radial pulses for a full 60 seconds, respiratory rate, and temperature. So, left arm. And the blood pressure in the left arm was 110/78, which was within normal limits. Okay, and we get 118/80 in the right arm, which is also within normal limits. He's checking his radial pulses for a full 60 seconds. And again, I would do that for a full 60 seconds, and he was about 63rd rate. And I would also check his respiratory rate. I would watch his inspiration and expiration for a full 60 seconds to assess his respiratory rate. Lastly, just going to check his temperature. And it's 97.9, which is within normal.